Hi, my name is Sam Lawrence. I'm one of the Georgetown anesthesia residents, and this video is meant to serve as a primer for third and fourth year medical students prior to your anesthesia rotation to show you some of the skills and techniques we employ every day in the operating room and to jumpstart your experience and to get you involved starting on day one. Creating an IV drip line is important for every patient. The materials are listed here and include a bag of fluids, 3-pronged IV tubing, and alcohol caps. First, hang the bag of fluids from an IV pole and squeeze the drip chamber on the IV tubing as you insert the spike into the port on the fluid bag. Release the drip chamber and the fluid will start to flow through the tubing. Close the roller flow control clamp once the fluid has reached the Luer lock collar. At Georgetown, we take infection control very seriously. Be sure to cap each of the 6 ports on the IV tubing with a green alcohol cap and twist at least 2 times. It's important to ensure the volatile anesthetic vaporizer is full prior to starting each case. Each anesthetic has a color-coded cap that matches the color of the vaporizer. Remove the vaporizer from the anesthesia machine by twisting the lock to be vertical. Unscrew the cap on the vaporizer and attach the color-coded refilling cap onto the volatile anesthetic bottle. Insert the bottle into the vaporizer, ensuring that the cap fits into the slots. Press down and look for bubbles in the anesthetic bottle, indicating you've inserted the bottle correctly. Once the vaporizer is filled, the bubbles will stop. Screw the cap back onto the vaporizer, reinsert it into the anesthesia machine, and lock it in place by twisting the lock to be horizontal. Drawing up medications is obviously something we do throughout the day, and here we'll learn how. You'll need a syringe, a blunt tip needle which are red, and your medication of choice. In this example, we'll be reconstituting Ancef. Remove the syringe and needle from their packaging and twist to connect the two. When drawing up any medication, it can help to put air in the syringe beforehand. Turn the medication bottle upside down and insert the needle into the bottle and inject the air. This increases the pressure in the bottle and causes the medication to flow easily back into the syringe. Pull back on the syringe to draw up all of the medication. Be sure to keep the needle tip below the surface of the fluid so that you don't draw up any air. In this example, we are reconstituting a medication, so you can see the resident injecting the saline he drew up into the Ancef bottle and mixing thoroughly. He'll do this twice to achieve the desired dose of the antibiotic. When the medication is drawn up, be sure to recap the syringe to avoid any inadvertent needle sticks. Here you can see this example of reconstituting a medication again up close. He injects a small amount of air into the bottle and then draws up all of the saline. He then injects the saline into the antibiotic powder and mixes. All of our anesthesia machines have attached label makers. Simply scan the medication bottle and attach the label to the syringe. Be sure to attach an alcohol cap at the end of the syringe. Dispose of the needle in a sharps container. It is very important to label all medications you draw up to avoid any administration errors. Now we'll focus on getting a patient ready for the induction of anesthesia, and this includes placing our ASA required monitors, which include EKG leads, a blood pressure cuff, and pulse oximeter. At Georgetown, our intraoperative monitoring consists of a 5-lead EKG, right arm, right leg, left leg, and 1 precordial lead V5. These are color-coded white, black, green, red, and brown, respectively. This shows the correct placement of the electrodes. The blood pressure cuff should be applied to the bicep of the arm opposite of where the IV is. Keep in mind the position of the blood pressure cuff sometimes changes depending on the patient and procedure, such as if the patient has a limb restriction or if the arm is the operative site. Finally, the pulse oximeter is applied to the tip of one of the fingers on the same arm as the IV. Wrap the sticky band around the finger to secure it. Like I said earlier, we take infection control very seriously at Georgetown, and so to ensure compliance, everyone in the anesthesia department utilizes the 5 moments of hand hygiene, which are listed here. We have hand sanitizer dispensers available outside each operating room, as well as inside the operating room on the Pyxis machine. Dispose of gloves in a sanitary manner by removing them without touching the outside. And don't forget to sanitize on your way out.